We have the awesome Dr. Gwen Covey-Crump back with us. She's been here many times. She is a very dear friend of mine and one of the people that inspired me to set up CAM, really. I knew her right at the beginning and she was very, very kind to me. And since then, we've stayed really good friends. Before I let her introduce herself, I'm just going to say thank you to our sponsor. I'm so grateful to be working with Big Barker. Very, very proud to be associated with them because we believe in evidence-based medicine and we believe people should actually prove what they suggest. And when somebody markets a bed as offering comfort, maybe some improvements in pain, mobility, quality of life, etc., is that marketing or is that true? Now, this company actually did put their bed through a clinical trial, a pilot study with the University of Pennsylvania, which had really positive results. So huge amounts of respect to the company that actually go to that length to be able to put their money where their mouth is and say, yes, it does perform. So thank you very much, Big Barker, for supporting us. Now, Gwen, tell everybody about yourself.
I'm Gwen. I'm a specialist in veterinary anaesthesia and analgesia. That's the posh title. So I work as an anaesthetist at a referral centre at Langford Vets. And one of those days a week, I'm running a pain clinic within the rehabilitation team. So I'm working alongside physios and then obviously referring with and consulting my colleagues in surgery, neurology, medicine, all sorts. So that's what I do as a job. And then when I'm not working for Langford Vets, I'm doing other professional things like helping Hannah with a few things occasionally. And various other things, and yeah, that's what I do professionally. Do you know what's about me personally?
You've got an inbox. In my inbox, you've got a box, and it's called Gwen's Gems. So whenever
I'm supposed to be making some videos for you, aren't I? But my problem is I don't have the inspiration or the camera kind of finesse that you have, Hannah. So I'm finding it quite difficult to make up these. You're going to have to email me some of these gems back so I can then make the videos for you.
That's fine. I can do that. Yes.
I've made a couple, including one in the arrivals hall at Heathrow when I was absolutely knackered. I made a video for you, so I need to just edit it.
There you go. You can start calling me the terrier like Duncan Lascelles. She just doesn't go. So tonight,
she doesn't give up.
I don't give up. Tonight is all about people bringing forward questions, and hopefully we will be able to answer them. One of the reasons that we're doing this is I want to actually showcase what is happening within our member zone. So anybody that's seen the CAM website, you'll see that there is a yellow tab at the top that says member zone. And that is something that we've been working really hard to create over the last few months, if not years. Within the member zone, guys, we have a private Facebook group and we do tea and chat questions every single month, me and a guest, so that we can actually offer you continuity, try and help you manage your cases, go back to your vets with pertinent questions to ask to drive your case management forward. So this kind of scenario that you're seeing now is actually happening in the member zone. So please do support CAM. Step over a very small paywall. It's only £25 for the year. We are independent. We do fund ourselves and we have got spiraling overhead. So please do get involved and carry on supporting us doing what we do. So tonight is question time. Please do pose your questions. But to start the ball rolling, we decided that we'd have a couple of case examples to get you in the mood. And I kind of posed to Gwen, let's talk about a case that requires regular reassessment to really illustrate that the idea that you go to the vet, you get a pill and that's it, sorted for life, that's done, isn't actually true. So Gwen, can you think of a case that you've been managing recently where regular reassessment really has brought it to its optimal point?
Yeah, so I think the case I'm managing at the moment, it's quite short, probably because I'm only part way through, but it's got a couple of examples of the reassessment approach. So very, very, very large, very lovely Leonberger with, I think discomfort in the hindquarters. We think he's got some hip dysplasia, if I'm remembering rightly. I get my cases all muddled up in my head, I'm afraid. I have to always read my notes before I see every client again. And very progressive muscle weakness, which is absolutely classic for an older dog, particularly and especially in a giant breed that has sort of long-term disuse, what we call disuse atrophy, so muscle wasting due to the way he's been using his limbs, which is it has changed with the arthritic process that he's going through. So he has been managed for a while on a number of drugs, and all of a sudden he got to a stage where he was struggling to get up, and this was a new thing, and the owner was already aware of changes going on, but this struggling to get up was a new thing. So the vet decided to actually refer him into physio, and actually at Langford we don't accept pure physio cases. Everything comes in through the rehab and pain management team, and so they all see me. And so one of the first things we did, so I met this dog first time with a physio in the same consult, which is a fantastic way to work. It's completely transparent the way I work. Confirm the muscle weakness. He's fairly overweight, so that's something that needs to be dealt with. But he's actually, in my mind, he's not that old, but I think as a Leonberger, I'm trying to think exactly how old he is. I'm thinking he's 6 or 7, but for a Leonberger, I think I don't know, that's certainly
pretty.
How long do they live? They don't. Giant breeds don't seem to live as long, do they?
No.
So then I'm going through medications and things like that. I talk through all the medications that a dog is on, and I also I ask questions about how often they're being given, if they're being given continuously, if the owner's giving them as and when necessary, and then we just look at those medications and see if what I'm doing first of all is trying to optimize what's already there rather than just introducing new things. And one of the first things I noticed was that he had been prescribed quite a high dose of gabapentin once a day, just at night. So, and a lot of vets do prescribe it to sort of help animals sleep, and actually that's a recognized use of, well, certainly I know they use that pregabalin for that in people. But it was quite a high dose. You wouldn't think it's less than 10 milligrams per kilo, but for this very large, weak dog, it was too high a dose. So we basically took the dose right down. So what was happening was in the morning. So she was finding she was giving the dose after he went out in the evening, because otherwise she couldn't get him out to the garden. We lie down in the garden, she couldn't get him up, and he's too big to lift. So then he'd be weak in the morning because she'd given the dose after his nighttime garden visit, and then he'd be weak in the morning. So we took the dose right down, and then we started thinking about whether we would actually use that gabapentin more appropriately over the course of the day. So we tried that, but it quickly became obvious that it was just way too much for him. It was making him weak. So, and that's something I see quite a lot in when animals are started on a drug like gabapentin, which is often appropriate, but they might then become it can enhance their weakness, and then the dog then appears to deteriorate. And so people see that. They don't see that as a drug-induced effect. They think the arthritis has progressed. So that was an interesting thing I found, and we've just stepped right back on this gabapentin. We're not actually giving it at all at the moment. But he's actually on Librela, and now he's got to his 3rd and 4th injection. He's getting a really good benefit from that. So I've actually pulled his medication right back since he's been referred into the pain clinic.
No, and I think that's a common scenario. And I think with that kind of case, I just really want people to go away and go, right, our line of work is not like pulling the light switch in the bathroom. The tick-tong, it's on and it's working. It really is much more a panel of switches, switching on, switching off, or dimmer switches, really, panel of dimmer switches. And I really want, it's good, that one, isn't it? Because a lot of people will go to the vet and they will assume that their vet's got a crystal ball. They've chosen exactly the right drug at exactly the right dose, exactly the right frequency. And that's what's going to see them through for the next 8 months to 8 years. And it doesn't work like that. So going back and having these reassessments, taking lots of information to your vet. So the fact that lady said he's quite weak, he tends to really struggle after the medication. Actually, I make sure I give it after I've walked him because he's really flat then. Gwen's able to go, that's not working how it should be working. So please don't be afraid of reassessments. Please expect to have regular reviews and make the most out of them. And this is where I go into a first opinion practitioner thing. We have people come in for meds check, and there's two people on the side of the table both going, well, you know, the owner's thinking, why am I here? You're just doing a quick review. That owner needs to come with information about how the dog is, how they're doing, how they're exercising, how they're sleeping, how they're eating, how they're moving. So that vet's got material to work with. And that vet needs to go, I'm listening. How's your dog doing? Because we might need to meddle.
And sometimes we're picking up on the tiniest little things that might seem really insignificant to the owner.
Absolutely.
And asking the right questions to get the owner to bring out this information that they think is not relevant, they don't want to bother the vet with in their really, really short consult, but actually it's really relevant. So just the fact that this dog lies down in the garden in the evening if she gives the medication at tea time and she can't get him up, and that's, you know, she didn't think that was important, but actually it's mega important. And the dog is still weak in the morning, despite the fact gabapentin is quite short acting. I think this dog is just really sensitive. We pick up on tiny little things sometimes, which are really important. My favorite one is fairy poos.
Oh, yeah. I was like, oh yeah. Tell them what fairy poos are.
So a weak dog will often not be able to maintain the posture they need to pass stool. This is the polite way to put it, to do a poo, all in one place, which is what a dog will normally do their poo all in one place, in one spot on the ground. So it's very easy to pick up.
You know what our term is? It's the poo-poo train. It's like dog, and it's like carriages.
And it was basically because they can't hold that squat for long enough, so they have to sort of get up, readjust their position, take a couple of steps, and squat again, and then repeat.
Yeah.
So and it's absolute classic. And the number of times I've put an animal on medication, or started some physio, or done some acupuncture or something, and the first thing the owners notice is they're not doing fairy poos anymore. They can pick up their poo with the poo bag with one hand and not have to go training after them.
Before we move on to it, people, please do post their questions. And another request is tell us where you're listening from. We get a lot of excitement at hearing at all different parts of the UK and the globe that we're reaching with the strong message from Cam about improved chronic pain awareness, education, management, etc. So tell us where you're listening from. To just play on another part of that story is weakness. And as you say, you're very fortunate that you work alongside a physio and you can use your observational skills together and decide whether a movement pattern suggests weakness or whether it's suggesting pain. Can you describe what that dog was kind of showing so that people can think about this? Because a lot of people will assume slowing down is all about pain. It's 100% about pain. Slow down because it's pain, but actually it's not, is it?
I think the thing that the owner had noticed was he was really struggling to stand up in the hindquarters, especially if he was on a slippery floor, not on carpet. So if he was in the kitchen, he just couldn't do it. And then what we're seeing, or what the physio is noticing, watching him rise on the very appropriate surface we have in our physio room, is that he's really pulling from the front end with his front legs and his shoulders, and he's got a big hypertrophied shoulder girdle, and just sort of then just managing to stand up with the back legs with a real sort of effort. Then when we examine him, he appears a little bit painful when we manipulate one of the hips, and slightly tender on one of his knees. I think he's got bilateral TPLOs, so he's had surgery on both his knees in the past. And otherwise, I mean, he's a very stoic dog, so it can be really difficult to tell if they're painful or not. But I think sometimes demeanor, and his demeanor's really improved with the treatment he's having with physio, and we've also done some acupuncture, despite the fact we've actually removed medication. So that to me makes me think he's more weak than painful. It's not set in stone, because
It's a very big spectrum, isn't it? And physios have certain things that they do. They might try and just lift one foot and see how the body copes.
Yeah.
They might do a withdrawal reflex and just see whether it's fast, but it's got no strength to it. And lots of things. So the physio vet team is a really good combo. I'm very jealous, actually. Very jealous.
Well, I mean, I just don't have those skills. It's amazing having them examine the animal as well as me and point out all the things that I would probably miss.
Hopefully in the next 5 to 10 years there'll be a physio in every practice, to be honest. I think it's I think we're heading that way. Many practices do have in-house physios. They might also
or visiting, who come and do clinics once a week or something.
And there's definitely a lot more nurses interested in rehab, and I know of a lot of first opinion clinics that are offering osteoarthritis consults with the nurse, who can bring in lifestyle exercise, maybe a few basic pieces of physio advice. So do inquire about that. As there's no questions yet. Oh, here we go. Okay, let's. I just said that one appeared.
There are some people listening out there.
There are people listening. So my dog has had 3 acupuncture sessions. I couldn't see any difference. How do we know if it's working? Also, my vet leaves the room and my dog shakes some of the needles out. They are not replaced. Is this normal procedure?
Okay, asking the last bit of the question first. It's quite often it depends. So quite often I try to stop the dog shaking, because the first thing I want to do when you finish putting needles in is shake, because you've sort of rucked their fur coat up, and they sort of they have that feeling of wanting to shake, especially if they're a bit anxious. They want to do a shake down, and that is the quickest way to get all the needles out. And then you spend the rest of the day looking for the needle in the corner of the room. So sometimes I'll replace them, especially if they've been in very, very short period of time. But to be honest, those needles are having their effect very quickly within the moment that they're placed through the skin, so into the tissues beneath. And the vet's probably doing some manipulating of those needles right at the beginning, sort of twisting them, which is having quite a powerful effect at the beginning. So not necessarily replacing the needles is not necessarily a bad thing if those needles aren't replaced, because quite often they've already had their effect. Some people do needling where they just put the needle in, manipulate it, and then remove it, and then put it in the sharp spin, or collect them so they count them in the end, and they don't actually leave any needles in, and that's also can be very effective. How do you know if it's working? Yes, this is the problem with acupuncture. It's incredibly subtle effects. This is another situation where I rely heavily on my physios. So quite often the most common beneficial effect owners report to me is that the dog's sleeping better. And he sleeps better the few nights after the acupuncture. So that might be something to look at as a marker as to whether acupuncture is helping or not. Because if they're sleeping better, it probably means they're more comfortable. But it probably, it might also be an indicator of release of endorphins and things like that, which is what we know acupuncture does. And sleep is really important. We know that lack of sleep or disrupted sleep can increase pain and other problems in the body, medical problems, etc. What else? So I rely quite heavily on my physios, as you've already heard, and they'll quite often say, look, there's a real different feel to the muscles this week, and the sort of muscle tightness I felt last week, that's actually dissipated. It's still there. We need to do some more work, and the physios will do some work. Quite often the physios are saying to me, please can you needle them first, because it makes such a difference for them then to go on and do their work. So quite often the therapist can detect differences, even if you've not seen it in your dog, and it can take, I generally say 3 to 4 sessions before you give up on it, but you need to speak to the person who's doing the acupuncture to look for markers of improvement and ask them, and they'll be honest with you as to whether they think it's working or not, because it doesn't necessarily help every animal.
No, definitely. And I think something, because I've been doing acupuncture for a little while now, I'm not Gwen standard at all. I'm dipping my toe thanks to the lovely Sam Lindley's course. And what I've learned in the short time I'm doing it is it's quite good to get a baseline of where we're at before the first session, do 3, and then cross compare from before week 1 to after week 3. Because when I've asked them to tell me how they've got on week by week, they're like,
don't know.
But when you actually look back, then you're like, actually, now that you come to think about it, 3 weeks, he is sleeping better. He is a bit more engaged. He maybe greets me at the door. He isn't flinching when I touch him. And another thing that I've really learned to do when doing any of the chronic pain work is being really honest with people and saying, you might see subtlety, it might be slow to develop, but if this is working, the sort of things that I'd like to see, so I can set their expectations within line. Because I do think a lot of people think that after a session of anything, they're going to start seeing their dog tap dance, and it's not like that. Can you just explain to people how acupuncture works in a elevator talk kind of speech, so that people know why putting the needles in and out actually isn't a bad thing? Because humans think more is more, when actually more is more.
So classically, we think of acupuncture as working on 3 levels. So the most basic level is what we call peripheral level. So putting the needle through the skin into the tissues, manipulating the fascia, which is those the sheets of tissue beneath the skin that wrap around all the muscles, tendons, ligaments, and you manipulate the fascia with those needles. You release, and so that you actually you can get some distant effects via the fascia. This is too long to spend describing in detail now, but release of what we call trigger points and things like that can happen via that method. You get local changes in blood flow, which brings in all the sort of healing factors, causes dilation of blood vessels, bringing in those healing factors, anti-inflammatory factors, wound healing, and all sorts of things like that we can go see with acupuncture. And then there's what we call the segmental level. So this is where the stimulus of the needle going into the tissues, which is a bit like an injury, actually transmits via nerves up to the spinal cord, and will create changes in the spinal cord at the spinal cord level, which can help modulate the way pain is processed. So it can change the way the spinal cord processes the signals of pain that become pain ultimately when they reach the brain. And you can affect at the segmental level. You can affect other body parts and organs within that nerve supply that comes from that bit of the spinal cord. So we sometimes, by needling a part of a back leg, you can actually affect some of the visceral organs, for example, which is a bit mind-blowing, really. This is all to do with circuitry and the wiring in the spinal cord. And then the third level is what we call the cortical level, or the supraspinal level. Supra meaning above, so above the spine, so cortex, and the processing that's going on in the brain to influence the processing of the information that ultimately is perceived as pain. And this is at all levels. Things like endorphins are released. And enkephalins. These are the body's own painkillers. But particularly at the brain level, there's some really important changes in neurotransmitters which can influence the way pain is processed. So, and that can also contribute to feelings of well-being, improved sleep, and that sort of thing. So,
when I think it was you that
is concerned, there's loads of other things that acupuncture do which I don't really get involved with because I just deal with pain.
Yeah, exactly. But I think it was you that described in the very primitive. What's the word? I can't think of the right word. But our circuitry setup of a new threat takes a priority. So by that needle, it's a new threat, and the body goes, "Shut up! What's happening?" And it can overwhelm that state that the brain's in. So if the brain's like, "Oh, chronic pain, chronic pain, chronic pain, chronic pain," and then you have a needle go bing, and it's done no damage, but the body's like, "What was that?"
Yeah.
I need to know.
I don't think that was me, but that's an interesting way of thinking about it.
Yeah, I don't know who taught me. It must have been Sam then, just saying, there's a lot of benefits to it, survival benefits of switch off that, listen to that, what is happening. So yeah, acupuncture, as you said, I think with any intervention, be it acupuncture, laser, medication, hydrotherapy, you name it, nothing comes with a promise. And it's about dealing with people's expectations, giving it enough time to work to get the best effects. We've got a good question here. So it's about 3 parts. My dog has increased stiffness, yet still has been maintaining muscles in her hind that she has built.
Great.
We do weekly hydro, and our physio saw her today and said that her stiffness has improved and she is not showing signs of pain. Second part. My question is, can I improve stiffness apart from just physio? Have been suggested acupuncture. However, she is often reluctant to sit still in physio consults. Finally, would love a physio vet combo with our vet referred, but infrequently having to go, and there's differences in opinion. Acupuncture for stiffness?
Yeah, I've not really thought about that before. So, well, stiffness is such a broad term, isn't it? So are we thinking stiffness in the joint? Do we need more synovial fluid, joint fluid? Is it discomfort in the muscles that are controlling the joint? Is that why they're stiff? I've not really thought about doing things like improving joint fluid with acupuncture, but I'm pretty sure you can, because ultimately it's about improving blood supply, which is ultimately going to influence that.
I think stiffness is such a broad term that we so readily lean upon.
Yeah.
And for somebody in our position, stiffness could be pain related, it could be neurological, it could be myofascial.
So myofascia is where we definitely can influence with acupuncture. I think that's probably the best. I think you should try acupuncture, because you say the dog won't sit still, but actually acupuncture is very good at getting needles in with the dog going around the room. We tried to get them to stay still, but they're not quite often. You get a few needles in and they'll lie down because actually they feel like relaxing. So it's worth trying, but the influencing the myofascia is the biggest thing I think might help here. Because the myofascia gets stiff because maybe of a lack of movement or in maladaptive movement. I mean, it sounds like your dog is really active and you've been keeping him moving and keeping those muscles built up and everything. That's brilliant. But yeah, I think probably the influence on the myofascia is going to be the biggest influence of acupuncture in your dog.
Yeah, and I think also something that I butted in. Something that I've learned as well is that there are actual changes within the joint. You know, the joint's range of motion is changed. And however much we would love to return our dog to the fluid, I'm just flowing, look at me bend, look at me climb. It ain't going to happen, because the joints don't do that anymore.
No.
And even if they're pain-free, they don't have the range that they had before. Yeah. So sometimes I'm finding myself talking to owners going, right, I think we're going to get as good as we are with the physical movement, but, you know, let's focus on his emotional state. Is he engaged? Does he want to do stuff? Does he want to play? Has he got the cheekiness? You know, because, you know, it's where they're at is really, really important, isn't it?
Yeah. I know. I mean, if you're seeing a physio, then I'm sure they're working on range of movement exercises to try and keep those joints as mobile as possible. But ultimately, if there's an arthritic process going on, as Hannah says, you might be building up excess bone in that joint, and it's a process that's very hard to slow down. And ultimately, you know, I'm just thinking about my feet and my bunion. So at the age of 46, my big toe does not bend enough for me to be able to squat on the ground anymore, and it actually won't bend any further, whether it's pain-free or not, because there's bony change there, and I can't stop that process. Well,
do you know my silly fact? I've got a silly fact. I don't know why this just popped into my head. Supposedly, Dolly Parton can't bend her feet anymore because she's worn high heels all of her life. That she's just, her feet don't. But it's a bit like my back. You know, I've leant over laptops and books all my life that I've actually not got good flexibility. I think there are some changes that come that aren't necessarily over pain, are there?
No.
Are there any contraindications to acupuncture before we move on?
I would say I'd be cautious in an animal that had a clotting disorder. I'd be very careful where I put my needles. skin infection is a tricky one, because I don't want to put needles through skin that has an obvious infection. I'd like to clear up that infection first, because you're introducing, you can introduce bacteria deeper into the tissues potentially. What else? So I can't really think of any other contraindications, really. Some people say cancer, but other people say it's good to use acupuncture for cancer, and I think it depends how you're using that acupuncture. I think people are worried about increasing blood flow to the area of a tumour.
Mm-hmm.
So that might be something. So acupuncture needs to be done cautiously and carefully in cancer. And they're probably the main ones. Help me out here. You've done a course more recently, Hannah.
No, I think they're the main ones. I think really assessing the dog for how they respond to it is really, really important.
Yeah.
I think sometimes there's a real wish that we want it to be done, and I found a couple of dogs that just do not like it at all.
Yeah, that's a good point. If the dog gets absolutely stressed out of their mind having acupuncture done, you could say that's a contraindication. And sometimes I'll give up for the sake of not, I'm not improving that dog's quality of life.
No, and whether that acupuncture would even work with the amount of stress and chemicals going on is. So now let's move to this acupuncture question, and then we will stop with the acupuncture. We're going to go on to the next case. Can it help with delayed proprioception?
I guess it depends what's causing the delay in proprioception, because I think you can get changes in proprioception simply down to stiffness and weakness and myofascial stickiness, where the myofascia gets all stuck up because there's that limited range of motion and things like that. And I think physios can do an awful lot there, and as can acupuncture in getting things back to more normal function. If you've got delayed proprioception because you've got a neurological deficit, a nerve injury somewhere, then again, if acupuncture can improve healing, then possibly, but I can't say categorically, in my experience, that acupuncture has any proven ability to heal nerves. But somebody might come in and cut me down and say, yes, it can.
I think it's there's acupuncture is quite a passionate field, I've found. And you've got some people like me that bring it in and they I dare say dabble with it, try and integrate it. And you have other people that write tomes and tomes. They read every research paper and they will have understanding of it being able to affect bone remodeling and nerve regrowth and stuff. And I think it's an interesting field, and I think you have to see what's within your radius of reach with regards to people that are qualified. Let me make it clear, only vets are allowed to do it, or vet nurses under veterinary guidance. So it has to be a veterinary professional. And what I was going to add to that as well, I can't remember what it was. Somebody primed me. So many people are telling me that they've done really well on acupuncture, which is lovely to hear. Oh, I know what I was going to say. So Gwen knows me very well, and she knows that I've been thinking about pain for a really long time. And there's many times that I've thought to myself, how the hell do you guide people when it's such a huge topic with so many combinations of breeds and ages and combinations of disease and comorbidities? And is elbow OA the same as hip OA? Is digital OA the same as cervical, cervical disc disease, all these different kind of combinations of degenerative joint disease, and we lump it all. Arthritis. And you're like, whoa, it's such a massive topic. So how can we ever know whether one thing is going to work or that combination is going to work? It's impossible. And what we really, really need to teach people is to have the empowerment to make decisions and go to the vet and go, I'd like to explore this. I have full expectations of it to work in this kind of time frame. I've got these observations in place to see if they change. I'm using a clinical metrology instrument. I'm using a questionnaire. I'm using the good day, bad day diary, whatever it might be. And then to be able to go back to that vet and either say, do you know what? I've seen some really positive changes. Or do you know what? The investment was great. I now know at this time in my dog's life, that isn't the thing that's making a big difference. What else can we explore?
Yeah.
And that's across the board, drug management, acupuncture.
Yeah, absolutely. I think reassessment and putting in place some markers of change, of improved functionality, that you as the owner can observe and score on a daily or a weekly basis, because the vet can only tell so much, or the physio, or it can only tell so much in the consult. I mean, you were talking earlier about bringing information to the vet. The classic situation I've had this week is the owner's husband bringing the dog in and knowing absolutely nothing about how the dog's doing. And actually it was a pretty pointless consult, because I think somehow they expected me just to know how the dog was getting on. And so much of it is report from the owner.
It totally is. You'll be impressed with me, because I have verbal diarrhea and things come out when I shouldn't. And then I kind of go, whoops, till I step over the line. So a lady did exactly the same with me recently. Her husband dropped off a dog, and it wasn't for a pain clinic. It was something else. And he was, here it is. I was like, so what's your dog in for today? He's like, I don't know.
It's like people think the dog can't talk to me.
No, so
when at the hospital for their appointment, because they can explain, maybe depending on what their mental faculties are. If it's a small child, you wouldn't expect.
No, but you will like what I said to her. She came to collect the dog later that day, because I had to phone her. I had to ask what was going on. Dog's staying. When she came to collect, I was like, "Your husband is chocolate teapot, isn't he?" She couldn't stop laughing. She was like, I know, I told him when he left the house, but by the time he got to you, he'd completely forgotten what it was about.
You need to write it down.
Exactly. Okay, so our next kind of case example I wanted you to talk about was a case that you had seen on a number of occasions, and then you go, whoa, stop. This isn't medical management. We've got maybe a surgical intervention that's needed. We need to do something a bit more. And I think a lot of people really fear this. And I've experienced this quite a few times, where a dog's maybe being treated with a non-steroidal, maybe an adjunct, and they've been going down a pathway. And the vet then goes, this ain't panning out how I'd like it. I think we need to review it. And we change direction dramatically. Can you kind of illustrate that case?
Actually, most of the orthopedic cases I have actually come to me from orthopedics. So they've already been worked up from an orthopedic point of view. I'm actually, the case that comes to mind is actually had ended up down a surgical route that nothing to do with orthopedics. So the dog I'd been seeing for a while with back pain, not fairly nondescript, what you might in the human refer to as low back pain. No particularly good explanation. X-rays looking normal, which we often see in early stages of arthritis, that the X-rays actually look normal. So he was being treated for musculoskeletal back pain, and he'd also previously been seen by medicine and diagnosed with effectively an inflammatory bowel disease, and so he was being managed for that. And then he was doing really well with his back pain, but he was exercising a bit more. And then his owners said he just suddenly pulls up when he's running. He's a lurcher, so he absolutely loves to run flat out. And he'll just pull up suddenly, and then he'll stop, and he looks like he's sort of gulping or sort of swallowing after, and then he gets out and trots off again, but won't sprint again that day. And I think we ended up deciding to get a soft tissue surgeon to look at it, and they diagnosed a hiatus hernia. Medicine looked at him because he'd previously been seen by medicine for a gastrointestinal problem, and they diagnosed a hiatus hernia, and it was quite a bad one. And so he had surgery for that hiatus hernia, and it made a massive difference to his certainly his exercise tolerance and his back pain. So this was a really good example. I mean, he's since sort of has ongoing problems. It's not completely resolved the problem, and quite often we see with chronic anatomical problems that are surgically corrected, actually that doesn't always completely fix the problem, especially if the pain pattern or the pattern of the sort of neurocircuitry involved in what was eventually perceived as pain in the brain is really hard to reverse. So sometimes even despite corrective surgery, you can still have a problem. So this is a classic for visceral pain, but there's an overlap between visceral pain and what we call somatic pain in the body, in the tissues, in the musculoskeletal system rather than the viscera. There's an overlap in those pains, and how and actually you can sort of map where the problem is in his viscera, his abdominal organs. You can map it to where in his back he suffers pain. So that dog probably has nothing to do with, it's not an arthritic pain he has. It was to do with his viscera. So that's an example of a dog that went to a surgeon for a completely
different thing,
different reason to what we originally thought. And then I've had another one that went, another dog that turned out to have hypothyroidism. Yes, it did have osteoarthritis, but the sudden downturn that it was suffering was not because of osteoarthritis, because it had an underactive thyroid. And once that was diagnosed and medicated, we got the dog back onto the straight and narrow and were able to carry on with her rehab. She was a completely different dog.
Oh, that's not uncommon, is it? And again, guys, the take home from that is when your vet suggests doing maybe a blood sample, or if they're saying, let's just broaden our thought processes here, let's check in on a few things. Don't resist them. They're not trying to get you money. They're trying to go, wait a minute, there's a few little clues here, a bit of weight gain, maybe a bit of panting, maybe a bit of, slowing down, stumbling, this sort of thing, maybe a bit of vacancy, not so cognitively alive. And, it's a sign of a really great vet to turn around and go, I just want to check things out, because we might have a comorbidity, which was actually my case 3. So this is great. We just flowed into it. But I hate to say it, splenic cancer, kidney disease, liver disease, hypothyroidism, potassium bromide toxicity, gabapentin toxicity. There's been so many things that people have gone, my dog's really getting a lot worse with their arthritis. And you break it down, you go, ain't the arthritis, it's this. But just to recap on the huge U-turn, I've had quite a lot of dogs recently that have come in with back pain, and actually it's been cruise ship. A dog that had horrendous back pain, like horrendous. They were like medial buttresses, both sides. And you got 2 unstable cruciates, and the back's now just gone, I'm done with trying to protect your knees. And so sometimes you will have cases that really look like they're going one way, and if they're not improving or they're deteriorating, you stop and you rethink. That's okay. Okay, so I want to ask about a case that went super well, because before we leave, I want people to go, oh my God, because I've got a great one to tell you about.
My main case is not to do with osteoarthritis. It's to do with pain.
Yeah, that's fine.
So we had I saw a dog that had a post-surgical complication after hip replacement. So it is to do with osteoarthritis, isn't it? So she had hip dysplasia and osteoarthritis of the hip that was becoming really problematic. So she had a hip replacement, and we have amazing success with hip replacements, and they're they've become almost routine now in certain surgical teams that are just really good at doing them. But occasionally you get a surgical complication, and she had a nerve injury.
Right.
And so she had a neuropathic pain, a true neuropathic pain, neurogenic pain. And it was associated with all the classic signs that she was, she had proprioceptive deficit. So she actually had a deficit in nerve signaling, but she also had pain. So she'd be chewing her foot specifically. And we treated her really successfully with pregabalin and and physiotherapy alongside. So the pregabalin was there to facilitate the physiotherapy, because she was quite, too painful to receive the physio to be able to do the exercises properly. And she, after 3 months of pregabalin at the full dose, she'd done so well with the physio, we started to wean her down. So we weaned her off very, very slowly. And, within 6 months, the dog was back to normal. And to me, that's a really short course for neuropathic pain. I warned the owners right at the start that this could take months, if not years, to resolve. But she's just done amazingly well, because the owner is super, super engaged with the physio exercises. And the dog is, just a motivated, not particularly, it's a fairly young dog. And, she started out without too much muscle weakness. So, she did have a huge amount of muscle loss very, very suddenly after the op because of this nerve injury. but it all came back on with the physio, because that dog and the dog's owner, kept her in the best possible condition, and her surgery was done at an appropriate time for her before it was too late, to get that muscle back. And so all round, that's just been a really successful case, and it's just really happy to see. It's a little bit different from your classic osteoarthritis story, but it is related.
Well, my one is it's a Shih Tzu, that Bella, and she has been your classic kind of slightly grumpy lady. She's got like a sway back that a horse would have, so high pelvis, high shoulders. She waddles, a bit like John Wayne in the front and the back end, and legs are facing different directions and all manner of things. Owners love her. And she came in for a pain clinic, and I think the owners were very much expecting us to just remodel the pain relief plan. And we were like, well, do you know what? Let's get deeper into this. Let's do the X-rays and let's see where we're at. And her hips, unbelievable, and her elbows also. And you flex the elbow, they did clunk, clunk. There was actually bone on bone endpoint to the range of motion. There was no movement there. And we discussed all the options, and we've got a big toolbox for pain management now. Big toolbox. And I decided to use polyacromide gel in all 4 joints. So brave move. So she came back in, and we stated her and put in both elbows, both hips. And you sit there stressing the pants off, because no vet ever wants to upturn the apple cart. No one ever wants to make anything worse. Everything we do is with best intention. But you sit there just going, and I phoned 4 or 5 days later, and just to check in. And you pick up the phone and you're like, how's it going to be? And she was like, I can't tell you how different my dog is. I go and pick her up, she doesn't bite me anymore. And I'm like, oh my God. And she went, yeah, she went from being missy bite. The groomer was in fear of her. She loves it. Bloody loves it. And I was like, can you believe that? Now, obviously, that wasn't just intra-articulars. There was weight loss, controlled exercise, there was systemic meds. There was a big plan. But super happy, just super happy. It made my month, really, to have, as you say, one of these pinnacle kind of moments where they saw a really profound change reasonably promptly. It doesn't happen all the time, does it?
No.
So there you go, guys. A very happy note to end on. Well, thank you so much for listening in, guys. Please say thank you to Gwen for giving up her time. And before we leave, we're just going to do a very quick 10 top tips for anybody that has experienced this. Oh, come on, Gwen. They've literally one sentence. You don't have to go into any detail. But one of the things that Cam really, really tries to do is make sure that everybody on every budget, from every background, with all your resources, you can still make a big difference to your dog. And that's what definitely started it for me. I was from a background where we had 2 Labradors as I grew up, Lancer and Bruno, and they made it to 15, both of them, but they weren't insured. They weren't even vaccinated, but they were very much loved pets. And all of these ideas, these 10 top tips, take that into account. So I'm going to start up with number 10. Weight loss. Massive difference. Number 9, Gwen.
Reassessment.
Good one. Going to the vet with as much information as possible for number 8. Number 7.
Going to the vet with a full list of medications, the doses, and the times that you give them.
That's a really good one. Number 6 for me, sleep. I never realised how important it is, but it's so obvious. I'm such a crumpy bitch when I don't actually sleep, and everything feels worse in life. If I get good sleep, positive mental attitude. Number 5.
Being kind in your interactions, physical interactions with the dog, and touch. Make the touch pleasant, not unpleasant.
No, that's a really good one. Enrichment and those sorts of games, don't make them frustrated, don't make them too difficult, but just spend time. That positive space is really, really important. Number 3.
No. Oh, put mats down. Get rid of your slippery floors. I don't care if you've got beautiful wood floors. Put some rugs down.
Yeah, I like that one. Number 2 for me is, and I see this all the time, if they're struggling, help them. And I see so many people go, oh yeah, we'll get up eventually. If he doesn't use it, he'll lose it. Help him up. Number 1.
Yeah, whatever you, so the pain is all about the brain monitoring the environment. So Hannah talks about input equals output. So if the environment is putting in a signal which is a danger signal, brain thinks it's brain interprets it as pain, the output's going to be behavior change. So if your dog's behavior has changed, it's not because he's being naughty. It might be because he's got a health condition or a painful condition that means he doesn't want to do that thing anymore. I saw somebody telling their dog off the other day for not jumping in the car. There's always going to be a reason that they don't want to jump in the car. That's my number 1. Is that I think Hannah's actually written it down in our notes. Input equals output.
Yeah, seriously, like the more I do this, the more I love dogs, because they actually just want to be our companions, and it's us not interpreting what they're trying to tell us is the big problem. Thank you so much, guys. You've got a massive fan. Do you know this lady? Who's this lady? Do you know Paula Rowe?
Who?
Oh, well, I thought she knew. I thought she knew, but she says thank you to you personally. So that's awesome.
Oh, great. Sorry, I do apologise if I don't recall your name. I'm hopeless. I'm absolutely hopeless.
I'm hopeless for names too. Thank you so much, Gwen, for giving up your time. Gwen is one of our advisors. We have 17 amazing advisors that we're really, really lucky that give up our time. So please say thank you to her. We have another Facebook Live tomorrow. Evie is taking the lead, and it's Dr. Mary Gardner talking about how to know when the time is nigh, I'm afraid. It's going to be an emotional one, but it is something that we do need to talk about. And then on Thursday, we've got the awesome Amy Hesback coming to join us talking about neuroplasticity. So it's a busy week in CAM. But until then, thank you, Gwen, for giving us your time. And take care, CAM followers.
Bye.